are providing an update on COVID-19.
386 medical staff isolating and have tested positive with COVID. And the forecast shows that by the beginning of February, we could have 220 active hospitalizations. Ceci a un grand impact sur notre système.
This has a great impact on our system. For people with COVID, but also for all New Brunswickers that need health care.
We must do what we can to mitigate the risks to our health care system and to ensure we can continue to provide essential and critical services. We previously identified the conditions that would necessitate moving to level 3, and all of those conditions have now been met. On the advice of Public Health, Cabinet is moving New Brunswick to the level 3 phase of our winter plan to manage COVID-19, effective tomorrow night at 11:59 p.m. We will be at level 3 for just over 2 weeks, or 16 days, until Sunday, January 30th at 11:59 p.m. Think of it as short-term pain for long-term gain. Cela nous donnera le temps dont nous avons besoin
This
pour
will give us the time we need to halt the transmission of the virus. It is time for the people of New Brunswick to get their booster shot for COVID-19 and for children aged 5-11
Dr. Russell
also.
will provide the details of what the move to level 3 will actually mean. Moving to level 3 was never something I wanted to do, and I really hate to take this next step. As a province, we need to get to the root of the problem so we don't have to repeatedly do this. And that is why we've been precise here on the 2-week break. This 2-week requirement is to ensure that our health authorities can manage our hospital system. One thing we must understand and we must be committed to is that we are not going to go through 2022 with our province in lockdown. We want to be in a position to have our schools and our businesses open at the end of these 16 days. Today, 83.3% of New Brunswickers have 2 doses of COVID-19 vaccine. 91% have 1 dose, and 28.7% have received their booster dose. We currently have 9 people in intensive care, of which 78% have not received their booster or are not fully vaccinated. In other words, 9% of the population accounts for 70% of the hospitalizations. I've been asked many times in media interviews this week about how far I'm prepared and willing to go with vaccine mandates. And while I'm not going to elaborate without the discussion and a full discussion with Health and Cabinet, I will say we're going to do what is necessary to protect all of New Brunswickers and to compel people to get vaccinated. Life will become increasingly uncomfortable and more difficult for those who are able to be vaccinated but choose not to be. We must also protect those who cannot be vaccinated. As we have done throughout the pandemic, we are taking steps to find a balance that enables us to provide the services that the public expects, while keeping our healthcare system from hitting a point where hard choices get made of who gets life-saving intervention because there are not enough resources available to deliver that care. Right now, Horizon and Vitalité regional health authorities, along with Extramural Ambulance New Brunswick, are working together to make sure that critical life-saving services are available for New Brunswickers when they need them. I want to thank everyone for your continued hard work and dedication to keeping the people in this province healthy and safe as possible. I
want to thank each and every one of you for your rigorous work and for your determination to ensure the health and safety of the population of the province.
I know this is not easy, and it has not been easy. And no one is more tired of COVID than I am. Je sais que cas n'a pas été facile.
I know that it has
To
not
help
been
alleviate the
easy.
pressure on the healthcare system, the Department of Social Development is working with long-term care operators to create new emergency long-term care beds throughout the province. These beds will provide alternate placements for patients that are waiting in hospital until a bed in the preferred long-term care location becomes available. C'est une mesure à court terme.
This
Elle vise à aider la
measure
à gérer la
aims
crise
to
de la
help
pandémie.
hospitals to manage
Une des mesures que nous
the
prenons
pandemic crisis.
ensemble pour
This
trouver
is
des
only
moyens
one of the measures that we're taking
afin de
together
permettre à notre système
to find new
de
ways
soins de
to
santé
allow
de relever
our
les défis
health
locaux.
system
Et il est
to
en train
meet the
de se
challenges of the provinces
What is also
of the
important,
province.
we remember that every one of us has a role to play. I ask each and every New Brunswicker to do their part by reducing your contacts and by protecting yourselves in every way possible. Protecting yourself and others that you could be around, but maybe it's not necessary to do so. And we're asking for this all-out effort over these coming 16 days. This includes wearing a mask, maintaining physical distancing, and getting fully vaccinated, including receiving a booster dose, as we know that has had a positive impact on reducing the severity of Omicron. If you're over 50 years of age, you are at higher risk of not just catching COVID-19, but of having a more serious case and ending up in hospital. Go and get your booster as soon as possible. If you haven't done so already, contact an RHA clinic or a participating pharmacist and make your appointment now. We are also in need of help from anyone with nursing experience who is not currently working in the healthcare system or is available to help. Our frontline healthcare professionals are struggling to provide care to patients amidst very challenging working conditions. This includes anyone that has experience in vaccinations who can offer assistance at this time when we're going to try to get as many people boosted as possible in as shortest time as possible. We want to hear from you. If you have these qualifications, if you're a retired critical care nurse, a nurse with experience, not working for regional health authorities or extramural, but have critical care experience in any case. A casual or part-time nurse working for regional health authorities or extramural hospital, ambulance, New Brunswick with critical care experience, and have your manager's approval to participate. A full-time regional health authority nurse with critical care experience who is presently working on a hospital unit experiencing a reduction in service or closure. A medical professional from other countries living in New Brunswick or Canada that could qualify to assist at this time. I've been in recent communication with dentists who certainly are well familiar with vaccinations, who are offering and willing to be part of a vaccination program to help us meet our goals and keep people safe. If you fail in any of these categories, if you fall into any of these categories and are interested in helping out, visit gnb.ca/COVID critical care or email rn2@gnb.ca to learn more. You can visit our COVID GNB website and also learn more on how to volunteer. I know it will be a rough 2 weeks for New Brunswickers, but the move to level 3 is necessary to slow the spread of COVID-19. We need our children back in school and sports. We need our businesses open and for business owners to be able to make a living. Nous avons besoin que nos enfants retournent
We
à
need
l'école et au sport.
our children to return to work and do sports.
Maintenus, ouverts, et que les
Our
propriétaires
institutions must
d'entreprises
remain open,
parviennent en mesure de gagner leur vie.
and owners need to be able to
We
make a
need
decent
to be able
living.
to see our family and friends. Nous devons être capables de voir notre famille et nos
We
amis.
must be able to see our family and friends.
This is a path we must take to get to that destination sooner. We have seen in other provinces how Omicron has peaked and then it drops off quickly. Our health authorities are seeing that same and predicting that same situation for New Brunswick. And we're seeing that we should peak this month and peak by the end of this month. Our challenge is in the healthcare system. Our challenge is to be able to maintain critical services to people who need it outside of the infection of COVID. Our challenge is to do what we can and to do our part over these coming 2 weeks so we can slow the spread. You know, it's likely many people will get COVID. And if it's an experience like I had, it was an experience where I was fully vaccinated and it was like a head cold. Yes, it contacted others, others got sick, but all were vaccinated and didn't have more of an experience than a head cold. But those that are not protected are so much more likely to be impacted negatively and even death and be in hospital. While some businesses will be able to continue to operate, the increased restrictions will greatly impact others. That is why we're taking steps to ensure help is available to those who need it most. Cabinet has approved Opportunities New Brunswick to launch an enhanced Phase 3 of the NB Small Business Recovery Grant Program. Under Phase 3, eligible businesses can apply for a non-repayable grant of up to $10,000, which is double the previous program. Les entreprises qui ont eu du soutien dans le cadre.
So businesses who have had support within the context of the two first phases remain admissible in Phase 3. During this phase, all retailers can make a request.
Businesses can also access a one-time subsidy of up to $300 to help cover accounting costs incurred throughout the application process. In addition, we will expedite the assessment process and target a 3 to 4 day turnaround so that businesses impacted will see immediate relief. Application for this phase covers
rising COVID numbers in New Brunswick, and as a result, officials say the province will now move into the level 3 phase of the COVID battle. So more restrictions coming into effect. That new phase will be instituted as of midnight tomorrow night for 16 days until January 30th. These new rules mean a ban on indoor gatherings, shutting down gyms, spas, and entertainment centres, and single house bubbles. That's it for me for this afternoon. I'm Beverly Thompson. Todd Vanderhayden is up at the top of the clock with your top stories.